Many women diagnosed with breast cancer will need to make important decisions related to their treatment. But studies indicate that a disparity in knowledge related to treatment options may exist among some racial and ethnic groups. A new study from the U of M Comprehensive Cancer Center explores where these disparities are most likely to occur.
There's been some prior work by our research team here at the University of Michigan that has shown that women who've been through the treatment process for breast cancer had low knowledge about the survival benefit and the recurrence risk of the two surgical options, the breast conservation therapy and the mastectomy, and that these knowledge deficits were related to their educational attainment, so the more educated women did have better knowledge. Our current study had a research objective of trying to evaluate knowledge in women who'd been through the treatment decision-making process who had early-stage breast cancer regarding the survival benefit and the recurrence risk of lumpectomy compared with mastectomy. And we were doing this study to follow up on prior work from our research team with a larger and more racially ethnically diverse sample of patients, and also specifically to evaluate factors that have been traditionally associated with quality of care, like surgeon volume and treatment setting, and to see if those factors had an influence on the knowledge or the informed decision-making of women who'd been through the process. Our results suggested that, again, we found low knowledge among women who'd been through the treatment decision-making process across all racial ethnic groups, but we found particular deficits in African American and Latina patients. We also showed that these factors traditionally associated with quality care were not associated with informed decision-making or with our knowledge measures. So surgeon volume or treatment setting did not affect whether or not women had good knowledge of their treatment options after they'd been through the process, nor did it really mediate the racial ethnic differences that we found. A positive finding, though, was that across women, if they reported that their surgeon discussed the treatment options with them, they were much more likely to have better knowledge about these options. There are a few things that women could take away from this study. And the first is just, again, if you are a woman diagnosed with early stage breast cancer, just to know that you usually do have surgical treatment options. Usually the breast conservation therapy and the mastectomy are options available to you. So to be sure that you understand both of those options very well, what the risks and benefits are, and then these other characteristics of the treatments that may be important to you. So be sure to ask questions of your surgeon and to make sure that you may explore other avenues for getting information. I think there are a few things, again, too, for surgeons to take away from the study. And one is just to be aware that not all women, having gone through the treatment decision-making process, come away from it with a good knowledge of the risks and benefits of their surgical options. And so we need to take that back to what's happening during the consultation to figure out if they're actually getting the information that they need during that actual process. All of the efforts that our research group is working on right now are going toward what we feel is an important outcome for women, which is improving the quality of their decision for breast cancer treatment and the decision-making process.